Dr. Anthony Fauci, a name synonymous with America's fight against COVID-19, is back in the headlines. After decades of public service, he's no stranger to controversy. He has navigated numerous health crises, becoming a household name during the pandemic. Now he's defending his record, addressing criticisms, and offering his perspective on the virus's origins. Fauci's recent statements have reignited debates about the pandemic response. From mask mandates to lockdowns, his decisions impacted millions. His voice remains influential, shaping public health discussions even after stepping down from his government roles. The nation, still grappling with the pandemic's aftermath, hangs on his every word. His recent interviews and public appearances offer a glimpse into his reflections on the pandemic. He addresses the challenges faced, the decisions made, and the lessons learned. As the world seeks answers and accountability, Fauci remains a central figure in the ongoing narrative of COVID-19. Fauci stands by the decisions made during those early uncertain days of the pandemic. He emphasizes the constantly evolving understanding of the virus. He maintains that recommendations like mask wearing and social distancing were based on the best available evidence at the time. He acknowledges that the guidance sometimes changed, reflecting the dynamic nature of scientific discovery. He argues that criticisms often stem from a misunderstanding of how science works. He emphasizes that science is not about absolute certainty, but about adapting to new information. He stresses that waiting for perfect data can be costly, especially during a public health emergency. He believes that swift action, even with imperfect information, saves lives. Fauci emphasizes that his team worked tirelessly, analyzing data and consulting with global experts. He maintains that every decision prioritized public health, even if it meant making difficult choices. He acknowledges the economic and social consequences of lockdowns, but insists that they were necessary to prevent a catastrophic loss of life. The origin of the COVID-19 virus remains a topic of intense debate. Fauci has consistently advocated for a thorough and transparent investigation. He emphasizes the importance of scientific evidence in determining the virus's source. He acknowledges the two prevailing hypotheses, natural origin and lab leak. Fauci maintains that the scientific community leans towards a natural origin, with the virus likely jumping from animals to humans. He cites studies that point to similar viruses found in bats. However, he emphasizes that the lab leak theory cannot be definitively ruled out without conclusive evidence. Fauci stresses the need for China's cooperation in the investigation. He believes that access to early data and samples is crucial to understanding the virus's origins. He expresses frustration over the lack of transparency from Chinese authorities, hindering the search for definitive answers. He argues that understanding the virus's origin is not about assigning blame but about preventing future pandemics. Fauci's statements have been met with mixed reactions. His supporters praise his leadership, his dedication to science, and his unwavering commitment to public health. They commend his courage in making tough calls during an unprecedented crisis. They view him as a voice of reason amidst a sea of misinformation. However, Fauci has also faced harsh criticism. Some accuse him of flip-flopping on key issues, eroding public trust. Others question the effectiveness of lockdowns and mandates, citing economic hardships and social disruption. A segment of the population harbors deep mistrust, fueled by conspiracy theories and misinformation campaigns. Fauci acknowledges the public's frustration and fatigue. He understands the toll the pandemic has taken on individuals, families, and communities. He empathizes with those who have lost loved ones, livelihoods, and a sense of normalcy. However, he urges the public to separate legitimate concerns from baseless accusations. He calls for constructive dialogue grounded in evidence and reason. Section 5. The Evolving Science of Pandemics. Fauci's Take on Uncertainty. Fauci stresses the inherent uncertainty of dealing with novel viruses. He explains that scientific understanding evolves as new data emerges. He emphasizes that initial assumptions can change, and recommendations must adapt accordingly. He believes that acknowledging uncertainty is not a sign of weakness, but a hallmark of good science. He argues that the public needs to become more comfortable with the iterative nature of science. He emphasizes that scientific knowledge is constantly being refined and updated. He believes that understanding this process is crucial for navigating public health crises effectively. He advocates for greater scientific literacy, empowering individuals to critically evaluate information. Fauci highlights the importance of clear communication from scientists and public health officials. He believes that transparency about what is known and what is unknown is essential for building trust. He acknowledges that the communication during the pandemic was not always perfect. He stresses the need for continuous improvement in conveying complex scientific information to the public. Section 6. Fauci's critics speak up from misinformation to mistrust. Fauci's critics argue that his handling of the pandemic was far from perfect. They point to instances where his guidance changed, creating confusion and mistrust. They question the effectiveness of certain measures, arguing that the economic and social costs outweighed the benefits. Some accuse him of being too close to the pharmaceutical industry, influencing his decisions. Social media has become a breeding ground for misinformation and personal attacks against Fauci. Conspiracy theories portray him as a villain, accusing him of malicious intent. His critics often cherry-pick data, misinterpret studies, and promote unfounded claims. This misinformation has real-world consequences, fueling vaccine hesitancy and undermining public health efforts. The politicization of the pandemic has further complicated matters. Fauci has been caught in the crossfire between political parties, with his words often twisted to fit specific narratives. He has been praised by some for challenging the previous administration's handling of the pandemic, while others accuse him of being a political pawn. This politicization has made it difficult to have a nuanced discussion about the pandemic response. Section 7. The scientific community weighs in support, dissent, and the nature of debate. The scientific community recognizes Fauci's contributions to public health. His decades of experience, his expertise in infectious diseases, and his commitment to scientific integrity earn him respect. Many scientists applaud his leadership during the pandemic, acknowledging the immense pressure he faced. They view him as a strong advocate for science-based decision-making. However, scientific debate is healthy and necessary. Some scientists have expressed disagreements with certain aspects of the pandemic response. They question the duration of lockdowns, the efficacy of certain mask mandates, and the communication surrounding vaccine development. This dissent is not a personal attack on Fauci, but a reflection of the scientific process itself. Science thrives on open discussion, rigorous debate, and the challenging of established ideas. Fauci himself acknowledges that disagreement is essential for scientific progress. He welcomes constructive criticism as long as it is grounded in evidence and logic. He believes that a diversity of perspectives leads to more robust solutions. The scientific community continues to learn from the pandemic, refining its understanding of the virus and its impact on human health. Section 8. Fauci's legacy, a career marked by triumph and controversy. Fauci's career spans over 6 decades, marked by both remarkable achievements and heated controversies. He has advised 7 presidents on HIV/AIDS, emerging infectious diseases, and biodefense. He played a pivotal role in the development of PEP and PrEP, groundbreaking HIV prevention methods. His contributions to public health have undoubtedly saved countless lives. However, his career is not without its critics. His handling of the AIDS epidemic in the 1980s drew criticism from activists who felt he was too slow to respond to the crisis. Some argued that his focus on scientific research came at the expense of addressing the social and political factors fueling the epidemic. These experiences shaped his approach to future public health challenges. Despite the controversies, Fauci's legacy as a leading figure in public health remains secure. His dedication to science, his tireless work ethic, and his unwavering commitment to fighting infectious diseases have earned him a place in history. He has become a symbol of scientific integrity and a trusted voice in times of uncertainty. Section 9. The Future of Pandemic Preparedness, Lessons Learned and the Path Forward. The COVID-19 pandemic exposed vulnerabilities in global health systems. Fauci emphasizes the need for greater investment in pandemic preparedness. He calls for strengthening public health infrastructure, enhancing surveillance systems, and improving international collaboration. He believes that learning from the mistakes made during the pandemic is crucial for preventing future outbreaks. Fauci stresses the importance of addressing health disparities. He acknowledges that marginalized communities often bear a disproportionate burden during pandemics. He advocates for equitable access to healthcare, testing, and vaccines. He believes that addressing health inequities is not only a moral imperative, but also a public health necessity. The development of safe and effective vaccines in record time was a remarkable scientific achievement. Fauci highlights the importance of continued investment in vaccine research and development. He advocates for supporting global vaccine distribution efforts, ensuring that everyone has access to these life-saving tools. He believes that global vaccination is essential for ending the acute phase of the pandemic and preventing future variants. Section 10. The Importance of Open Dialogue, Fauci's Plea for Reason in a Divided World. Fauci has repeatedly called for greater civility and respect in public discourse. He laments the erosion of trust in institutions, experts, and scientific evidence. He believes that the spread of misinformation and the politicization of public health issues pose serious threats to democracy and public health. He urges the public to engage in constructive dialogue, even when disagreements arise. He emphasizes the importance of critical thinking, urging people to be discerning consumers of information. He encourages everyone to rely on credible sources, consult with healthcare professionals, and avoid spreading misinformation. He believes that a well-informed public is essential for making sound decisions about personal and community health. He calls for greater media literacy, empowering individuals to identify and reject false or misleading information. Fauci remains optimistic about the future. He believes that science, reason, and compassion can guide humanity through this challenging chapter. He stresses the importance of unity, cooperation, and a shared commitment to the common good. He hopes that the lessons learned from the pandemic will lead to a more resilient and equitable world. Section 11. Conclusion. Seeking Truth in the Age of COVID-19. Dr. Fauci's defense of his COVID-19 decisions offers a glimpse into the complexities of navigating a global pandemic. His story highlights the challenges of communicating science, the importance of adapting to new information, and the need for open and respectful dialogue. His legacy, though not without its critics, will be remembered for his unwavering dedication to public health. As the world continues to grapple with the pandemic's aftermath, Fauci's insights serve as a reminder of the importance of science, the need for transparency, and the power of collective action. His story is a testament to the resilience of the human spirit and the enduring pursuit of truth in the face of uncertainty. The COVID-19 pandemic has been a defining moment for humanity, challenging our assumptions, testing our limits, and revealing both our strengths and weaknesses.